Buildings impacts people's health and well-being, and achieving a positive interaction between buildings and occupants has been a long life passion. So my research is at the intersection between building design and performance, visual and thermal comfort, and human health and well-being. And I apply these to different contexts, like, for example, hospitals. So hospitals are spaces that we all have had interaction with, like we have all been either in hospital, either as visitors or as patients. And these are spaces or places that are quite stressful. You're normally there because you might be having some debilitating physical condition. So hospitals are not only very confronting spaces, but they're also quite complex buildings. So if we want to design for hospitals to make them places of healing and recovery, we need to pay attention to the built environment. And one of the things that I focus on is on the lighting design. So I looked at the access to daylight, the access to views, and the good lighting design in the space. Because these are aspects of the building that affect people and can have either positive or negative health outcomes. So for example, in patients, good lighting could improve their sleep, can reduce the number of days they're in the hospital, can reduce the stress. And for the healthcare workers, it's the same. Lighting can improve the alertness, reduce the number of errors, and they also reduce the stress and increase the satisfaction. So the aim of my research is to design circadian lighting systems that cater for the needs of both patients and healthcare workers in terms of the needs for alertness and performance. So I do this by measuring the luminous environment. So I use sensors to measure the lighting and quantify and qualify the lighting of the space. I also collect data to understand the needs of the patients and observations to understand how the healthcare workers use the spaces. And I need all this to understand the conflicts that we have in patients' rooms, so then we can actually design solutions that cater for both healthcare workers' needs and patients' needs. So this research will enable us to design better hospital spaces and patients' rooms with abundant natural light, with views and good lighting that will help both patients and healthcare workers' health and well-being.